Self-management, social prescribing are not really very well known. What it's all about is working with people to get them sources of non-medical support for life issues and health problems that they may have. It was set up through the Scotland's mental health strategy, which was from 2012 to 2015. In that strategy, they wanted to look differently at common mental health problems in Scotland and how we deal with them. So in terms of reshaping care, it was about moving away from a diagnosis model and moving towards helping people to become resilient and access sources of support in communities. It's a terrific approach, very good for people and good for our systems. In the past, there's been a very medical model, a clinical model, where you get an illness diagnosed. But the idea of this is that for life issues and for issues that you have with health that can be long-standing health problems, that you can get referred to social supports and non-medical sources of support. People find it often quite difficult to get the support they need for a variety of reasons, but in particular people who are in areas of deprivation do find it particularly hard. They may have complex needs and difficulties accessing support in their own lives anyway, and particularly when they're ill or have life issues. So social prescribing is really helpful in terms of overcoming people's own barriers or the barriers that they experience, and help to link them positively to sources of support which can make a big difference to them. For the future, I'm hoping that this group will leave a very good legacy over Scotland, that we'll be able to set up resources that people can tap into to help set up their own social prescribing and roll that out all over Scotland. The kinds of things that we'll put on the website will be about learning together, about research, and also practical things like how to set up a scheme, what's been successful in other projects, what kind of information you need to feed into a scheme and find out what the benefits have been, how to make sure that you've got the capacity locally and the resources you need, and how to make sure the schemes reach the people who need them most.